Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM, OET, and NCLEX Institutes. Today, I've got doing a very special recording for you because we have got two guests. One is Ash. She has cleared her CBT UK, and the other one is Preet, who has cleared her CBT New Zealand. So we will just talk about randomly. We have not prepared anything, so we are just going to ask how was the exam, how tough it is, and also at the same time would encourage you if anybody needs CBT UK or CBT New Zealand coaching from us, do let us know. But yeah, by the time, let's discuss with them. So, Nation Preet, how are you doing?
I'm doing fine, sir. Thank you for asking. How are you?
I'm very good, thank you. How about you, Preet? Are you all good?
Yes, sir. I'm good.
Okay, the two different timings, one in UK, one in New Zealand. Okay, so could you please tell me how many questions are there in CBT UK? So Ash, you can answer first.
Total 120 questions are there, sir, in which 15 questions are in part A and the rest are in part B.
15 questions part A and
Yes, sir.
105 questions are in the part B.
Part B, yes, sir.
How about you in New Zealand?
Sir, same 120 questions, but 12 question part A and rest 108
Okay.
in part
There
B.
are like 12 questions part A in New Zealand CBT,
Hmm.
whereas in UK
Yeah.
CBT there are 15. So it's just a difference of 3 questions, and both are drug calculation based part A.
Yes, sir.
Yes, sir.
Okay, so in both the places, whether New Zealand or UK, we have got drug calculations questions. Great. How tough they are, the drug calculations? Can you give any example of drug calculations first from your side, Ash? Any example, just a small example, like simplest of example of drug calculations, like what kind of calculations come?
It is pretty basic, sir. They have given us the dose that we need to give to the patient and the dose that we have in hand, and just we need to find out what volume of the drug we are going to give to them. So what is the basic formula that we use is desired dose upon dose in hand into volume. The medication that we have, volume, it is in mls. So that is the basic type of questions that we get, or other
What-
type of question can be
Still,
about.
still, the question is pretty complex for me if I tell you myself because I'm well trained in CBT as I'm trained in OET and in NCLEX, but I'm not trained in this peculiar part. So, like, what does it mean? Like, you have some drugs in your hand, you have some, how much dosage would you give, like, according to your hands? Like, can you
For
please?
example, sir, they've said that you need to give 250 mgs of amoxicillin,
Okay,
and you have in your hand a 5 ml vial which contains 500 mg of amoxicillin.
okay, so I will
So
give
you need
half
to
the
tell,
weight.
yes, you need to tell how much ml will you give to the patient.
Okay, so 2.5 ml.
Exactly, sir.
Okay, so
That kind of questions we have.
you are saying it's just simple drug calculation that you have got 5 ml vial, which has got 500 mg of antibiotic, and the patient needs to be given 250 mg of antibiotic. So obviously, I will give half the vial. So half of 5 ml is 2.5 ml.
Yes, sir.
Okay, that sounds all good. Okay, cool. Any question? Any other question, Preet? Any other question from your side? You also get the similar kind of questions, I guess,
Yes, sir.
in as well.
Similar question with similar formula
Okay.
and a few question with the we need to get mls and mm, like calculate the timing, how
Okay.
much fluid need to we give in this much time, like
Okay. To me,
you have
suppose if there is
500 ml.
okay, suppose if there are 500 ml given, it's to be given in 1 or 2 hours, then how much would you give in half an hour or something like that? So timing is also one of the important things. That is what you
Yes,
say?
yes,
Okay, cool.
yeah.
Any other example, Ash, from your side? Just one more example if you can. Otherwise, we can jump on to the next part B.
Yes, sir. Most of the questions also contain a picture where they'll show you a syringe or a vial of the medicine, and
Okay.
you'll need to tell how much medication is there. There'll be markings there, like this is zero point 0.9 ml, this is zero point 0.5. So you need to see how much volume is there in that syringe, and you need to write the correct answer along with the correct unit.
Okay. And are these along with the correct units? So units are also
Yes.
very important. So it's like fill in the blanks, majorly in the part A.
Yes, sir. It is pretty basic.
It is pretty basic, and these are majorly fill in the blanks.
Yes, sir.
Okay,
And
that
we need to be
sounds
very careful when we calculate the dose from mg to
okay.
microgram to gram,
Okay.
like this,
So means you are
milliliters.
saying that apart from the drug calculations, it's important to mention the units. If we are talking about milliliters, then it has to be in the mLs. If it is about micrograms, then you have to be very specific that you have to put in the micrograms. So units are very specific and needs to be taken care of in the part A, right?
Yes,
Yes,
sir.
And
yes,
part
sir.
A is majorly is of fill in the blanks when it comes to CBT UK or New Zealand. And also one thing we have got that in CBT New Zealand, you have got around 12 questions in the part A CBT, whereas in part A CBT of UK, you have got around 15 questions.
Yes.
Sounds all good. Thank you very much for this lovely participation. Let's talk a little about part B as well. Part B, otherwise, it should be more of multiple choice questions, I guess.
Yes, sir. All of those
Yes,
questions are multiple choice only.
Okay, and multiple choice questions. Like I have heard, there are a lot of questions which are priority based. Like if the patient has fallen in the bathroom, if the patient has fallen, then what is the first thing that you will do?
Yes, sir. Majority of questions are like that only.
Majority of the questions in the UK CBT are like that. You are talking about the priority based questions. How about in New Zealand?
yes, sir. We also getting the same kind of questions, priority based. What's your first priority after
Okay, okay, great.
all
So means in the
and
part B,
any drug missing?
multiple choice questions and that are majorly priority based. And also, are there any questions based on medications, based on conditions, diseases, anything like that?
There can be about 1 to 2 questions regarding that,
Uh,
but as I told, that majority of the questions are scenario based and priority based only.
okay, so you are saying in UK, majority of the questions in CBT are the priority based. And how does it happen in New Zealand, Preet? What are the kind of the questions?
Sir, we are also getting same, but I also got some question related to the disease conditions,
Okay, mentioning about
sign and
signs and
symptoms.
symptoms.
Yes,
So means suppose if they have given of a of a disease like diabetes, they might ask what are the complications that can happen in diabetes. Like if I talk about retinopathy, neuropathy, nephropathy,
yes,
thing like that can be given in the options.
yes,
Suppose if we are talking about hypertension, so we can say what is the precautionary thing you can do means by avoiding salt or something like that in the patients. Something like this can come.
exactly. Under
Okay.
yes.
And Ash, you were talking something about cultural based. Like, what do you mean by cultural based questions? Like in UK, like according to the population or something? I think that should be related to vaccinations or immunizations.
Yes, sir. It can be that also. And along with that, there are some questions that are based upon their NHS. One of the question can be, how many units of training do you need before you can work as a registered nurse? Or like they'll give a specific hours or units that you need 35 units to do that. And some of the questions can contain what is the main
Exactly does it mean?
responsibility of the NHS.
I don't know about it. What does it mean? 35 units of training.
That is basically they are asking about some your practical hours that you need to have before you can work as a registered nurse
Okay,
or
so it is like 35 units means 35 hours.
something like that. Yes, sir.
So the answer is 35 anyhow.
Yes.
Okay, got it. All right. Thank you very much for this participation. Obviously, that this was a small, I don't want to make it a big video because if anybody needs help, they can directly contact us. But yeah, thank you very much for your participation, both of you girls.
And it's one more thing about the timing. It's 180 minutes means 3 hours.
Okay, yeah.
All
Sorry, really sorry. That was an important thing. So how much time do you get, Ash, in CBT UK?
It is also same, sir. 3 hours from 30 minutes you'll get for your part A and 2.5 hours for part B.
3 hours, 3 hours in totality. One,
Yes, sir.
out of which first half an hour, that is 30 minutes for the part A, 15 questions.
Yes, sir.
And how about the New Zealand, Preet?
Sir, actually, I forget the exact timing for
Okay.
part A or part B
But you managed,
because
but you managed to.
I finished before time,
Okay, cool, fair enough.
Mm.
So you finished before time.
like maybe 20 or 25 minutes,
Okay, 20, 25, maybe 30 minutes. Maybe you would not have.
not 30.
Okay,
Mm.
so it's less than 30 minutes when it comes to 12 questions of CBT New Zealand. Overall, it is
You're
180.
gonna get enough timing, more than enough.
The timings are enough until now. I hope they don't make it too complex like NCLEX. But yeah, even in that case, for NCLEX and NCLEX coaching, we are right there. But yeah, CBT UK and New Zealand is not that complicated as compared to when we call about NCLEX training of Australia or Canada or USA. But anyhow, yeah, thank you very much for being there and thank you for your participation. I just wanted to have a fair idea because again we should not explain too much when it comes to candidates need to prepare by themselves, and if they need any professional help obviously we are there, otherwise they have got notes from here and there. But yeah, thank you very much for your participation and many congratulations on clearing your CBT UK and CBT New Zealand. Thank you.
Thank you, sir.
Thank you very much, guys.